I'd like to take a minute now to introduce our first guest, and we're really pleased that David has joined us again. David Lindgren, the Senior Manager, Compliance and Public Affairs for Flexible Benefits Service Corp. David, good morning.
Good morning. Thanks for having me.
Nice to have you on here, David. David, I can't move into this interview without saying it. I didn't recognize it before when we talked. You're a Buckeye.
I am a Buckeye. Yes, I am.
I am a Buckeye too, David. Nice to have you, buddy.
Oh, we'll have to be nice to each other then.
Yeah, there we go. Well, David, listen, give a little background to our audience just briefly on Flexible Benefits Service Corp. for those that might not know you guys.
Sure. We are a company headquartered out of Rosemont, Illinois, a suburb of Chicago. We are a third-party administrator on a national basis for account-based health plans such as flexible spending accounts, health reimbursement arrangements, and health savings accounts. And we also operate on a wholesale level, working with about 4,000 independent insurance agents and brokers on a national basis to help them with their sales and administrative support for their employer and individual clients. And lastly, we also are a private insurance exchange operator.
Yep. So you've just done an interesting survey on the continued growth of health HSAs and or FSAs and HSAs. Talk to us a little bit about some of the key findings of the survey.
Sure. Well, first, we were, as a third-party administrator for these accounts, we have a natural curiosity to understand some of the market trends and market penetration. So we reached out to several employers to get some feedback from them as to what types of plans are they offering, and how has the Affordable Care Act had any impact on these plans. And I think one of the biggest key findings that we found was that of more than 500 respondents, almost 90% of them are offering a flexible spending account. And that was a number that came in a little bit higher than we thought would come in. And I think we have come to the conclusion that that's largely attributed to the recent ability to incorporate rollover, that up to $500 rollover into those flexible spending accounts, in addition to these accounts being around for nearly 40 years.
Yeah, and David, do you think, even though they capped it, that's a small percent that impacted, whereas the rollover impacts a lot more, and thus the kind of growth opportunities that you're pointing to. Would you agree?
I would most certainly agree. Yeah, I think that you're spot on there.
Now, David, you see, from an HSA standpoint in this survey, did you see, growth in the HSA market as well with this survey?
Absolutely. That one of the other key findings was just the tremendous growth that the HSA market has seen really across employers of all sizes. And, there's a number of things we can contribute to, but I did hear you guys talking about private exchanges just before myself jumping on, and those are, we believe, a major contributor to the growth in these types of accounts, as a lot of employers are migrating to the private exchanges using a defined contribution model, and there's just an economic incentive for employees to migrate to those lower premium plans that you can couple with a tax advantage HSA. And we only see, as these private exchanges become more and more popular, that HSA growth will be significant.
Now, David, when you say you're seeing growth in the FSAs, you're seeing growth in the HSAs, what are you seeing from this study that's relevant to the HRAs out there in the marketplace and the people that you surveyed?
Sure. We see HRAs really, from a growth standpoint, really remaining flat. And as we compared our survey results to other survey results, some findings are showing even some declining rates with the number of employers offering HRAs. And we accredit that largely to the HRA becoming what we believe more to be a niche product for specific market segments. For your very smaller size employers, a lot of them have the fully insured coverage, and they're integrating an HRA with that coverage to offset the deductible or some of the out-of-pocket expenses. And then for your much larger employers that continue to offer coverage to retirees, we see a migration from traditional retiree coverage to a retiree HRA as being pretty popular. but sort of those medium-sized, middle market employers, a lot of them, they self-fund their entire major medical coverage, and they don't have as many retirees that are eligible if they even offer retiree coverage. So we think that's sort of where the HRA has found a real good niche right now in those smaller and larger group market segments.
Yeah, let's talk a little bit about the Cadillac tax, because I think it's looming out there, and I think one of the biggest issues that we all have in this space, I'm sure you see the same thing, is that the current counting of the HSA, contributions towards, the tax. What do you see right now as it relates to Cadillac tax, and what are you guys, pushing for that you'd like to see changed if possible?
Sure. So, the Cadillac tax is still a few years out, and we don't yet have any pending or final regulations on it, but the IRS did release Notice 2015-16 earlier this year that sort of gave an overview of what products they thought would be included in the total value of coverage. And flexible spending accounts, both contributions made by the employee and the employer are expected to be included. Health savings accounts, contributions made by the employee, as well as, or I should say contributions made by the employer, as well as any salary reduction contributions made by the employee are included. And then the value of an HRA is expected to be included, which future guidance is supposed to tell us how to estimate what the actual value of an HRA is. It's not necessarily the total annual reimbursement, but might be something more along the lines of an estimation based on historical utilization amongst the average employee. And so with that being said, that adds a lot to the Cadillac tax, or at least to the value of coverage. And we, myself being the primary author, did submit a comment letter to the IRS asking for some relief there and to exclude these products from the Cadillac taxes. We think they're part of the solution, not part of the problem, as it relates to the increasing cost of and the rising cost of healthcare and the utilization of those services. And I know some of the associations that we are members with have submitted some similar comment letters, and we hope they'll view them favorably when they do start to propose some actual guidance.
That's the thing we're all waiting on, is the IRS ruling, and then the next step would be some type of lobbying effort if we have to. When do you think that ruling may come down from the IRS?
Sure. So first, the next step would be for them to the comment letters were to be submitted by the end of May, and usually it takes them a few months to sort through those comment letters. I know last I checked, there was at least 300 different commenters that submitted information lobbying in one way, shape, or form against typically against the Cadillac tax. So that should be a few months, and then after that they'll start to propose the regulations. So I wouldn't expect to see it probably any sooner than the end of this year into the start of next year, when we'll start to see, again, proposed guidelines, which will more than likely have the ability to provide some additional comments as well.
David, so along the lines of what employers have to look at with, in regards to the law, are you seeing them take a wait and see approach to the high deductible plans and putting those in place, or what's the environment on the employer side given the law that they have to look at?
Sure, it's still a little bit mixed. We typically do see at least one high deductible health plan being made available as an option, but for most of our employer clients, it's still just one option amongst at least a few other plan options. It's not the only option. So the Cadillac tax may force some employers to make only high deductible health plans as their option for employees, in an effort to reduce or eliminate any impact from the Cadillac tax.
So you see this actually spurring the growth of full replacement plans inside the employer segment with a single option.
At least for some employers, yes. And again, that ultimately depends on what the actual regulations include, but that's most certainly, even absent the Cadillac tax, we've seen, a migration to the higher deductible health plans. Again, the private exchanges, fueling part of that as well. But I think the Cadillac tax is only going to make that migration even faster.
Hey, David, when it comes to compliance, which is the number one headache that employers knows working with employers have, and actually you have an exchange platform as well, how are you helping your clients deal with compliance?
Sure. So we really see there's three primary areas of compliance. There's compliance around the cafeteria plans. There's compliance around ERISA, and there's compliance with the Affordable Care Act. And we help, as an administrator of cafeteria plans, we help with training and the appropriate documentation that's necessary, the summary plan descriptions and so forth that's necessary. We do similar document preparation around ERISA. And then we do have a questionnaire or a survey that we offer to employers who don't have their own legal counsel or who are interested in utilizing our services. But we run through a series of questionnaires around the Affordable Care Act to identify if there's any areas of noncompliance or potential noncompliance, and then sort of try to put together a plan of action for them to get on track and being compliant. But it's pretty much all done just through dialogue and correspondence, through phone and web-based conferences and in-person meetings, just doing a lot of spot checks and making sure they're as compliant as they can be, and there's no financial exposure or other potential legal exposure.
Well, David, we really appreciate you joining us on the program today. If you could, let our audience know how they can access this survey.
Sure. So our trends report, if you visit our website, flexiblebenefit.com, you can download a PDF copy of it. It's about 14 or so pages in length. Any interest in our private exchange, we have a separate website for that, ixshealth.com, and you can find out more information about that there.
All right, David, well, thank you so much for joining us today on the program. Have a great weekend up there in Chicago, and we look forward to talking to you again.
Thank you very much. Go Buckeyes.
Yeah, go Bucks. Thanks, Dave. Take care.
Figured you'd like that, Doug.